موز نجيب الدمس هذه. شايف كيف؟ واللي قطعناه منها ندقه زي كذا. نعم.
You're complaining about waiting 3 hours for a doctor? They treated pneumonia with plants. No hospitals. No antibiotics. Just knowledge passed down through bloodlines, whispered around fires under endless stars. When death knocked at a Bedouin tent, they didn't pray for mercy. They reached for roots, leaves, and seeds that could pull someone back from the edge. In a place where the nearest physician was hundreds of kilometers away, every grandmother was a pharmacy. Every elder carried cures that modern medicine is only now beginning to understand. These weren't folk remedies or superstitions. They were precision treatments, tested over centuries in the harshest laboratory on Earth, where a wrong diagnosis meant death and the right plant meant survival. The desert taught them which herbs could stop bleeding in minutes, which could break a fever, and which could save a child from dehydration when water ran out. This knowledge wasn't written in books. It lived in their hands, their eyes, their sense of smell. A Bedouin healer could identify 50 different medicinal plants in complete darkness, just by touch and scent. They knew which part of each plant held the cure, when to harvest it, how to prepare it, and exactly how much to give. Their medicine chest wasn't a building filled with synthetic compounds. It was the desert itself. Every wadi, every rocky outcrop, every patch of scrubland held healing power for those who knew where to look. They carried this knowledge across generations like a sacred flame, never letting it die. Because in the desert, that knowledge was the difference between life and death. When European explorers first encountered Bedouin healers, they dismissed them as primitive. How could these nomads, living in tents, know anything about medicine? But those same explorers often owed their lives to Bedouin treatments when their own physicians failed them. Desert fever that European doctors couldn't break was cured in days with bitter desert herbs. Infected wounds that should have led to amputation healed cleanly under plant poultices. The Bedouins understood something that took modern medicine centuries to learn. The human body and the natural world evolved together. The same environment that created diseases also provided their cures. Every challenge the desert presented, heat, dehydration, infection, poisonous creatures, was matched by a plant solution growing nearby. It wasn't coincidence. It was the result of millions of years of biological partnership. They also understood that medicine wasn't just about treating symptoms. It was about understanding the whole person, their environment, their diet, their daily patterns. A Bedouin healer would examine not just the illness, but the patient's tent, their water source, their travel route, their emotional state. They knew that healing required harmony between body, mind, and environment. This holistic approach extended to their diagnostic methods. They could read illness in the color of someone's eyes, the texture of their skin, the sound of their breathing, even the smell of their sweat. They understood that the body spoke its own language, and those who learned to listen could intervene before symptoms became life-threatening. Their treatments were never one-size-fits-all. The same illness in two different people might require completely different remedies, depending on age, constitution, season, even the phase of the moon. They understood personalized medicine long before the term existed, tailoring every treatment to the individual patient and their specific circumstances. Most remarkably, they achieved success rates that would impress modern emergency rooms, using nothing but plants, careful observation, and generations of accumulated wisdom. In a world where medical mistakes meant death, they developed a system of healing that was both remarkably effective and surprisingly gentle. They didn't just fight disease, they restored balance, working with the body's natural healing mechanisms rather than against them. This was medicine stripped down to its essence: observation, understanding, and the precise application of natural remedies. No technology, no laboratories, no pharmaceutical companies. Just human knowledge, passed down through generations, tested in the most unforgiving environment on Earth. And it worked. In the endless expanse of sand and stone, where modern medicine would be helpless, Bedouin healers saved lives with nothing but plants and wisdom. In the endless expanse of sand and rock, the Bedouins found their pharmacy growing wild. Each plant was a specialist, selected by nature to survive the impossible and to heal those who lived alongside it. These weren't garden herbs or carefully cultivated medicines. They were desert survivors, concentrated with compounds that could mean the difference between life and death. When fever struck, the kind that burned through a body like fire through dry grass, they turned to Artemisia herbalba, desert wormwood. This silver-leafed plant grew in the harshest conditions, its bitter compounds concentrated by months without rain. The women would gather the upper stems just before dawn, when the plant's essential oils were at their peak. The leaves were dried in shade, never sun, to preserve their potency. The preparation was precise. 3 parts dried leaves to 1 part boiling water, steeped until the liquid turned dark amber. The medicine was given in tiny sips, one every few minutes, allowing the body to absorb the compounds slowly. Too much at once would trigger vomiting, wasting precious medicine and water. The plant's natural compounds attacked infection at multiple points, disrupting bacterial cell walls while cooling the blood from within. Research has since confirmed what they knew by instinct. Desert wormwood contains potent antimicrobial agents, including artemisinin compounds that modern science uses to treat malaria. But the Bedouins understood something pharmaceutical companies are only beginning to grasp. The whole plant worked better than isolated compounds. The bitter oils that made patients grimace also protected their stomachs from the medicine's harsh effects. For wounds that wouldn't stop bleeding, cuts from rocks, bites from desert creatures, tears from thorns, they used Achillea fragrantissima, the desert yarrow. This hardy plant grew in rocky crevices, its roots digging deep into stone to find moisture. Its leaves were covered with fine hairs that protected it from the sun, and those same protective compounds could save human lives. Fresh leaves were the most potent. A healer would crush them between her palms, releasing a sharp, clean scent that warned of the plant's power. The paste was pressed directly into wounds, held in place with strips of cloth. Within minutes, bleeding slowed as the plant's astringent properties contracted blood vessels. But the healing went deeper than just stopping blood flow. The yarrow's natural antiseptics prevented infection, while anti-inflammatory compounds reduced swelling and pain. Wounds treated with desert yarrow healed cleanly, without the festering that killed so many in the pre-antibiotic world. Modern studies confirm it contains compounds as effective as synthetic clotting agents, plus antimicrobials that many bacteria still can't resist. When stomachs turned against them, from bad water, spoiled food, or the stress of endless travel, they reached for Mentha longifolia, wild mint. But this wasn't the gentle mint of modern tea gardens. Desert mint was concentrated, sharp, almost medicinal in its intensity. And the Bedouins didn't use it the way you'd expect. They didn't make tea. Instead, they chewed the fresh leaves slowly, letting the oils coat the mouth and throat before swallowing. This method delivered the active compounds directly to the digestive tract, bypassing the stomach's acid that could destroy weaker medicines. The menthol calmed spasms in the intestinal walls, while antimicrobial compounds killed harmful bacteria. The effect was almost immediate. Nausea subsided, cramping stopped, and the dangerous dehydration that came with severe digestive illness was halted before it could take hold. Modern medicine has identified the specific compounds responsible: menthol, menthone, and rosmarinic acid, but pharmaceutical versions rarely match the effectiveness of the whole plant. For respiratory problems, the dry coughs that came from breathing desert air, the lung infections that could turn deadly in days, they prepared Myrbium vulgar, white horehound. This unremarkable-looking plant grew in the most barren areas, its small leaves covered with white wool that protected it from heat and cold. That same protective mechanism made it invaluable for human lungs. The entire above-ground plant was used, harvested when small white flowers first appeared. It was boiled slowly, for hours, until the liquid reduced to a thick, bitter syrup. Patients took small spoonfuls every few hours, the bitter taste a promise of the medicine's strength. The plant's natural expectorants loosened mucus trapped in the lungs, while anti-inflammatory compounds reduced the swelling that made breathing impossible. Children who had wheezed through the night would sleep peacefully after a dose of horehound syrup. Adults struggling with pneumonia found their breathing clearing within days. The plant worked so reliably that mothers would search for it specifically when planning long journeys, drying and storing it against future need. Each remedy required not just the right plant, but the right part of the plant, harvested at the right time, prepared in the right way. This wasn't casual herbalism. It was pharmaceutical precision, developed through centuries of trial and error in an environment where mistakes cost lives. But the real test of Bedouin medicine wasn't treating cuts or stomach aches. It was facing the killers, the illnesses that could end a life in hours if left untreated. In the desert, where help was always days away and resources were always scarce, these life-or-death moments revealed the true sophistication of their healing knowledge. Respiratory infections were among the deadliest threats. The combination of dry air, dust, and temperature extremes created perfect conditions for lung disease. When someone began wheezing, struggling for air, gasping in the night, there was no time for gentle remedies. This was when they reached for their most powerful medicine, concentrated preparations that could reverse respiratory failure in hours. The treatment began with Myrbium vulgar, white horehound, but not the simple tea used for minor coughs. For life-threatening cases, they prepared what they called the dark syrup. The whole plant was boiled for an entire day, reducing gallons of liquid to mere cups of thick, bitter concentrate. This syrup contained levels of active compounds that would challenge modern pharmaceutical preparations. Patients received the medicine in precise doses, measured not by spoons, but by drops counted carefully onto the tongue. Too much would trigger vomiting, wasting both medicine and the patient's remaining strength. Too little would fail to break the cycle of inflammation that was suffocating them. The dosing required the kind of precision that modern intensive care units achieve with electronic pumps and constant monitoring. The horehound worked through multiple pathways simultaneously. Its natural expectorants loosened the thick mucus that blocked airways, while saponins reduced the inflammation that narrowed breathing passages. But the plant's most crucial compounds were the diterpenoids, complex molecules that modern pharmaceutical companies now extract to create advanced bronchodilators and anti-inflammatories. Within hours of the first dose, patients who couldn't speak for lack of breath were able to whisper. By the second day, they could sit upright. By the third, they were breathing normally. Modern emergency medicine, with all its technology, rarely achieves faster results in severe respiratory distress. Dysentery presented an even more immediate threat. The bloody diarrhea that killed more desert travelers than heat or thirst could drain a body of fluids and essential minerals in less than a day. When someone couldn't keep water down, when their body was emptying itself of every drop of life, conventional medicine was helpless. But Bedouin healers had developed treatments that worked even in the most advanced cases. Their weapon was Punica granatum, pomegranate bark, but not from the familiar fruit tree. Desert pomegranates were smaller, tougher, their bark concentrated with compounds that could halt internal bleeding and kill infectious bacteria. The preparation required extraordinary skill. Only the inner bark was used, scraped away in paper-thin layers and ground to powder, so fine it felt like silk. This powder was mixed with the smallest possible amount of liquid, sometimes just enough to form a paste. Patients received doses the size of a fingernail, placed directly on the tongue, and allowed to dissolve slowly. The medicine had to reach the damaged intestinal lining without triggering more vomiting, and this delivery method ensured maximum absorption with minimal gastric upset. The tannins in pomegranate bark worked like internal bandages, binding to damaged tissue and stopping bleeding within hours. But the healing went far beyond just controlling symptoms. Ellagic acid and other polyphenol killed the bacteria causing the infection, while gallic acid reduced the inflammation that was destroying the intestinal walls. Modern research has confirmed that pomegranate bark contains some of the most powerful antimicrobial compounds in nature. Recovery was dramatic and swift. Patients who had been unconscious from dehydration would be alert within 24 hours. The bleeding stopped, the cramping subsided, and the dangerous fluid loss was halted before it could cause organ failure. Within 3 days, most patients had recovered enough strength to travel, a recovery rate that would challenge modern emergency medicine even with intravenous fluids and antibiotics. The most challenging cases were those involving multiple systems, fever, respiratory distress, and digestive collapse all at once. These were patients on the edge of death, requiring combinations of medicines that had to work together without interfering with each other. Bedouin healers developed complex protocols for these emergencies, using 3 or 4 different plants in carefully timed sequences. They might begin with artemisia to break the fever, follow with horehound to clear the lungs, then add pomegranate bark to stop internal bleeding. all while supporting the patient's strength with date paste and camel milk. Each medicine was timed to avoid interactions, dosed to complement rather than compete with the others, adjusted based on the patient's response. These protocols represented the pinnacle of pre-modern emergency medicine. Without laboratories, without monitoring equipment, without any of the tools modern medicine considers essential, Bedouin healers achieved success rates in critical cases that would impress contemporary intensive care specialists. They did it through observation, experience, and an understanding of plant medicine that took generations to develop and perfect. This wasn't guesswork. Every preparation followed exact measurements, passed down through generations like sacred formulas. Too little, and the medicine was useless. Too much, and the cure became poison. The difference between healing and harm often came down to measurements as precise as those used in modern pharmaceutical manufacturing. They knew that timing mattered more than most people could imagine. Capparis spinosa, desert caper, was most potent when harvested at dawn, before the sun concentrated its bitter compounds into levels that could damage rather than heal. The flowers had to be picked at a specific stage of bloom, when the white petals were just beginning to unfurl, but before the stamens had released their pollen. Too early, and they lacked the alkaloids that made them effective. Too late, and they contained compounds that could cause liver damage. The harvesting was done by the eldest women, whose experienced eyes could judge ripeness to the hour. They moved through the thorny bushes in the pre-dawn darkness, selecting only perfect specimens. Each flower was examined individually, those with the slightest blemish or wrong stage of development left behind. A single batch might require visiting dozens of plants to gather enough perfect flowers for one patient's treatment. Preparation was equally precise. The flowers were dried in complete shade, laid on special mats that allowed air circulation but prevented any direct light from touching them. The drying took exactly 7 days, not 6, not 8. On the 7th day, the flowers would crumble at the lightest touch, releasing a distinctive scent that confirmed they were ready. If the scent was wrong, the entire batch was discarded regardless of the effort invested. Storage required its own expertise. Dried medicines were kept in leather pouches made from specific animals, treated with specific processes. Gazelle leather for respiratory medicines, as its fine grain prevented moisture while allowing beneficial oils to penetrate slowly. Goat leather for digestive remedies, as its natural tannins enhanced the medicine's astringent properties. Each pouch was sealed with beeswax and marked with knots that identified the contents by touch alone. They understood dosage with mathematical precision that rivaled modern pharmacology. A healthy adult male weighing about 70 kilograms received what they called one full measure. A woman received 7/8 of that amount, adjusted for the fact that women's bodies processed medicines differently. Children received doses calculated by a complex formula that considered not just weight, but age, general health, and even the season of the year. Elderly patients presented special challenges. Their bodies processed medicines more slowly, so doses were reduced and spread over longer periods. But they also required stronger initial treatment, as their weakened systems couldn't fight illness as effectively. The balance was delicate, enough medicine to be effective, but not so much that it overwhelmed organs already stressed by age. Pregnant women required the most careful calculations. The medicines had to treat the mother without harming the unborn child, while accounting for the physiological changes of pregnancy that affected how drugs were absorbed and eliminated. Some medicines were forbidden entirely during pregnancy. Others required completely different preparations, often using different parts of the same plant to achieve therapeutic effects without crossing the placental barrier. The healers developed what amounted to a complex decision tree for every medicine. If the patient was young and strong, use the standard preparation. If elderly, reduce the dose but extend the treatment period. If pregnant, switch to the root instead of the leaves. If the illness was in its early stages, use the gentle preparation. If life-threatening, use the concentrated version despite the increased risk of side effects. They also understood drug interactions centuries before the term existed. Certain combinations of plants enhanced each other's effects, allowing for lower doses of each individual medicine while achieving better results. Other combinations were dangerous, with one plant potentially amplifying another's toxic effects to lethal levels. This knowledge was memorized in the form of songs and stories, making it impossible to forget even under the stress of emergency treatment. Quality control was built into every step of the process. Before any medicine was administered, it was tested on the healer first. A tiny amount was tasted to confirm potency and purity. The color, scent, and texture were compared to mental standards developed over decades of practice. Any deviation from the expected characteristics meant the medicine was discarded and prepared fresh. When antibiotics arrived in the 20th century, many Bedouin remedies were abandoned as primitive. Western medicine promised faster, more reliable cures with less effort and guesswork. But now, as bacteria develop resistance to synthetic drugs and pharmaceutical side effects prove increasingly problematic, researchers are returning to those desert plants with new respect. They're finding compounds that work through mechanisms modern medicine never imagined, attacking infections through multiple pathways simultaneously, supporting the immune system while fighting disease, healing without the devastating side effects that often accompany pharmaceutical interventions. Plants that the Bedouins used for centuries are yielding new antibiotics, anti-inflammatories, and immune modulators that could revolutionize modern medicine. The Bedouins didn't just survive in the desert. They thrived there, armed with a medical knowledge so sophisticated that science is still catching up. In a world where the nearest help was beyond the horizon, they built their own, one plant, one cure, one precisely measured dose at a time. Their legacy lives on not just in the plants they used, but in their approach to healing, careful observation, precise measurement, and the understanding that true medicine works with the body's natural healing mechanisms rather than against them.